My proudest accomplishment from the OT 2103 grant is the implementation of a program that introduces an innovative way of bringing healthcare closer to an individual's home. Although the island is very small, a lot of our population still lack a means of transportation to access healthcare, and therefore we meet our community members where they're at, and that really impacts the access of care to the community.
We as a group have a couple of accomplishments we are very proud. Giving mini grants to CBOs is one of them, but keeping with the theme of this conference, I would say the Social Determinants of Health Dashboard for Puerto Rico is going to be the first one in Spanish, very targeted to vulnerable populations, and it's our baby. At the beginning, we didn't have the funds or the means or even how to do a dashboard. We knew we needed to unite the data because it's fragmented within the Department of Health. So we started having this talks with stakeholders and getting ideas and requesting TAs, and through the funds we could purchase specialized statistical packages, geoanalysis packages that are expensive, but it helped us make it a reality.
Proudest accomplishment of the OT 2103 grant is the first ever Health Equity Summit that was held in Palau in February of 2023. This summit convened over 500 participants, both in person and online, international partners, regional partners, federal partners, all joined in as well. From that summit, we made a lot of partnerships and collaborations, and some of the work that weren't being done before the summit has now started back up and is moving forward because of the summit being held and bringing everybody together. So that's my proudest accomplishment.
I think we've already started to improve some lives of people. Our CHWs have created some really good relationships with our senior homes and the housing communities, and the people there are looking forward for them to come. So their patient care has begun. We've had the connection that have been made. So the community as a whole in the Virgin Islands already benefiting from our CHWs and their presence in their communities.
Okay, so basically, as you understand about the Republic of the Marshall Islands, we actually divided up into 28 or 29 atolls. And with that, we only have 52 health centers with only 45 that are actually currently active. And with that, most of our people hardly receive good health care, access to quality health care. So the first things first is that the people actually will be benefiting with this move in trying to prioritize quality and accessibility to quality health services with the neighboring islands.
One of the issues that we had, our project is with improving access and utilization of our EHR. And one of the issues that we had was kind of a working and collaborating relationship between the partners, which was Department of Health and our hospital. The EHR is kind of a universal tool that's being used, and there wasn't really great collaboration. I think 2103 went a far ways towards building that relationship back up and establishing communications and enabling us to build upon what was already there and move forward into the next steps. Having a universal EHR helps us to get better data and better information to help us make decisions that affect people's health care and help us to serve them better. And so that's one of the goals of this project, is addressing health equities by using data-driven decisions.
We have the support of our community and our people who are in charge of the Virgin Islands, the governor, lieutenant governor, commissioners, etc. So we have a good support system.
Our main partner is with the LBJ Tropical Medical Center, and that's the one acute care hospital in American Samoa, but we also partner with our FQHC and our community health centers and other programs. I'm from the ELC program, and that's been a strong partnership from the beginning.
It's really a community effort. We did have to work with, again, the experts, the Diabetes Foundation of Guam, the Guam Diabetes Control Coalition, the Guam Diabetes Association to get the experts in providing this training. Also those at the University of Guam, the cancer and tobacco experts to help us provide this training.
Of course, CDC, as well as ASTO, WHO, and other international and regional partners, as well as local partners as well, local community partners.
If you take a Pacific Island shoe and you try to put it in your feet, it feels so different, because it actually can feel sand and corals on your feet, because it will be so uncomfortable when you come from a well-resourced setting to a low-resource setting. So that is the biggest challenge that I want to embrace to the agency. If you want to support this move to the neighboring islands, these are the untouchables. And that is why public health existed.
To plan it ahead of time, get everyone involved, all the programs, all the leadership, even community members, and if there's any advisory boards or councils in the Ministry of Health and Human Services, have them on board too.
We come from small communities, and so relationships go a long ways. And so building the relationships so that when opportunities come along, you're taking advantage of those opportunities, but together as a team, and you're ensuring that there's equity across all of our partnerships to make sure that we're all able to succeed together as a team.
Is to ensure that uninsured and underinsured individuals continue to receive access to health care. In analyzing our data, we have noticed that a majority of our population have relied on presumptive Medicaid to catch up on routine healthcare visits and medications, and we want to ensure that other healthcare costs are covered by other public health programs who can assist.
Expanding on the Office of Health Equity, the commissioner is in the process of identifying someone to fill the position of Director of Health Equity, with hopes of having that office be one of the offices in the Office of the Commissioner.
We've been talking about this topic at home, and in this conference it has highlighted as well. We need to institutionalize an Office of Health Equity. If not, the program is going to get diluted within all the projects of the Department of Health, and we found that the Department of Health of Puerto Rico is in dire need of a specific health Office of Health Equity. It's a must.
Working with ASTO in these last few years and months has been a great advantage for us. Having the peer-to-peer, learning what are the successes in other jurisdictions so that we don't reinvent the wheel.
Policy. We need to start, now that we're working towards gathering data, gathering information, evidence-based, we need to start talking about policies.
By continuing to provide TA as needed, and they are very helpful, and we rely on them to ensure that we are doing it correctly and as best as possible.
I want to say that the team in ASTO has been a great help for us. I think bringing our jurisdictions together once in a while and in providing technical assistance and trainings, sharing best practices.
As a Pacific Islander, I actually can feel there's a biggest gap that actually happens in all the ministries in the Pacific Islands, which is health system strengthening. Right? So if there was something for any funder or any stakeholder to come in and support the Pacific Islands, it's through health system strengthening.
One of the greatest things is that we've had great support from all of our partners, both on the federal level and on the NGO and TA provider level, and I'm thankful for that. And all of us, these are all new projects. We haven't done any of them before. They're quite unique, and so it's been very helpful to work with people that are also learning at the same time and sharing what they're learning.
We're very proud of the work we've done because it's very rewarding, and we would like to thank ASTO and the CDC team and other national partners such as NACHO, Partners in Health, and subject matter experts for making this possible.
Health equity is a lot of work. It's a lot of work. Nothing is gonna always be complete. We are always going to be working towards advancing to health equity, but it's such a rewarding experience. It's such a rewarding work and beautiful work to help those vulnerable populations that have been silenced and that haven't been heard.
I'd just like to take this time to thank ASTO as well as CDC for the partnership and the funding support, funding opportunity, and this is the first time that health equity has ever been brought up in Palau. So we are optimistic, and we know there's a lot of work ahead of us, but our team is optimistic and we're ready.
I appreciate the opportunity to be here and to create new relationships with the people that are convened here. We come from different island nations, but we're all islands, so to speak, the same. And it's interesting to see how our cultures cross over, even over oceans. Pacific, Atlantic, we share some of the same goals and ideals, and family, community is the foundation of those things. So that was good for me.